Hi, I'm Dr. Don Smith, and today we're going to talk about exams and why we do exams. And at the same time, when we're doing this, I'm going to be talking in some cases most of the time to the doctors and to the assistants, but sometimes to patients also. I think some of these same informations can be helpful for patients. And I'm going to start out by talking about what we call an initial evaluation, or sometimes called a comprehensive exam, comprehensive initial exam. The terms are used somewhat interchangeably, but now the most commonly used term is evaluation. Well, why do we do an evaluation from a patient's perspective? What we're looking for is that we're looking for things that we can find about why a person might have a certain issue. A lot of times that are called complaints. I mean, in the medical industry, often it's referred to as a patient complaint. This is the chief complaint. Well, a lot of times patients don't see it that way. They see it as something that they'd like to have looked at, that they'd like to have the information interpreted, and then come up with a fix. That's really the basis of what we're doing is, how are we going to fix this? Well, it seems to me that analogies often work. And it helps, I think, to understand the things that we're doing. And right now, Charlie, I'm going to kind of digress, and I'm going to tell Jameson you don't have to stay. He got the camera going for me now. He's out in the All right. So now I'm going to go back to the issue at hand as far as what we're doing. And so the evaluation. One of the analogies that I think of is that when we're doing an exam. Excuse me. My allergies are kind of acting up a little bit. I'll do my best. We'll get through this together. But my analogy for an exam or an evaluation is that at the time that, and I'm going to speak about doctors, at the time the doctor is doing the exam, he's really serving as a detective. And what he's doing is he or she, the doctor, is gathering the information on the written part of the exam. In other words, the paperwork that the patient has filled out. They're going over their medical history. In some cases, they're telling us the symptoms of what they've been experiencing, and the doctor is taking the information from the health history, the symptoms that the patient is telling the doctor, and then the doctor also uses signs, things that we call signs. All right, so what's a sign? Well, those are things that we see. Things that we see that the patient may not be aware of. And again, I compare signs. People will, I'll say to people, do you grind your teeth? They'll tell me no. No, nobody's ever told me I grind my teeth. I don't grind my teeth. And I'll say to them, well, I see signs that you do. And a sign is similar to tracks in the snow. If you've ever seen a deer track in the snow, a deer's been through there. Or if it's the first person that goes down a street after a snow, and there's tire tracks there that indicate a car drove through the snow, well, you may not see the car, but you see the signs that the car has been there. And that's what we mean by signs. Again, the patient is telling us the symptoms, and then we're looking for signs that we see. So while we're doing this evaluation, or while we're doing this exam, what we're doing is we're being a detective. We're being a detective, we're putting this information together. And actually, the information that we're putting together are facts. It's a fact of what the patient told us. It's a fact of what the patient tells us as symptoms. It's a fact of what we see as signs. And then the various tests that we do are in support of those facts. The tests that we do are going to support the facts, or they're gonna say maybe we're heading in the wrong direction. So we need to look at some other facts. In other words, a patient says that a tooth hurts, and it doesn't hurt all the time. And if they bite together, if a patient bites together with nothing between their teeth, they bite and they bite hard, and the tooth hurts, that tells us something. All right, well, the patient may be that they can bite together with nothing between their teeth, bite hard, and nothing hurts, and yet when they drink something hot, then the tooth hurts. Well, see, that's a test. That's a test, that's a thing that we do to help us to come to a conclusion. So we gather these different, the different informations together, we put them together, and then in the process, we're putting this together so that we can present to the patient the facts. Well, once that happens, and now I'm talking to the doctors too, pretty much. Once that happens, at that stage, then we become a reporter. Because really, what I'm doing at that point with the patient is presenting the facts. I'm telling the story. I'm telling the story to the patient of what I've learned from all of the information that we've gathered. Now, why am I doing this? Well, the reason is to come up with a treatment plan. And in other words, this is the problem. We're going to tell the patient this. This is the problem. This is what we're finding. This is what you're experiencing. And these are the different ways that we can fix them. And you may have, you meaning the patient, you may have 2 or 3 options to choose from about how we're going to fix this. Well, this is where I think it's really important that the detective, who is at this point a reporter, who is now again reporting the facts and now getting more facts back, the doctor should be asking the patient, what do you want? These are the options that we have, and I'll just put it this way. It may be that the tooth, because of what's going on with that tooth, that it needs a crown. And yet at the same time, it could be done with a 4-surface restoration. Well, a 4-surface restoration is less of a complicated treatment than a crown. At the same time, a crown is a more secure restoration once we get to a 4 or 5 surface filling. Filling restoration, I kind of use those words synonymously sometimes. And so then it's the patient's response. It's the patient's decision about what kind of treatment they would like to have. Well, what we want to do, we as the provider, during this exam, we want to present to you your options and present to you the pros and the cons of each one. And now I'm going to say this. And if the doctors have a question about this, they can ask me. If patients are seeing this and they have a question about this, then you may inquire about that. You may say, well, why did he say that? And what I'm going to say is that I have grown comfortable over the years leading patients to an outcome. So what do I mean by that? Well, there's a big difference. Let's say that a tooth needs to be replaced. A tooth needs to be replaced. There's a big difference in the fee. In other words, there's a big difference in what a patient's going to pay for an extraction, an implant, and then a crown, as compared to a root canal and then a crown. But there may be patients that don't want to do a root canal. And there are patients that don't want root canals. They know that. Well, then we need to know that, because if that's part of our process for coming up to a solution, and the solution is not something you want, then the patient needs to help us understand what it is they want. And then a lot of times, we all need to understand this. This decision might be based upon what the patient's willing to pay. In other words, if insurance is a big part of how patients make their decision on what kind of a treatment they're going to have, well, then the doctor might as well ask that question, because it's in the back of the patient's mind. How am I going to pay for this? Well, that's part of the exam process, because to come up with a treatment plan that is ideal for the doctor, but it's not acceptable to the patient, then we're not helping either one of us. Our goal is to help patients get treatment. Because I've seen this. They will leave here not knowing what to do, and they'll just let it go. And then it becomes a problem at a later date. Well, let's help the patient come to a solution. And it's kind of the same thing. And now I'm going to address the hygienists, because the hygienists don't diagnose, but the hygienists help us to gather the facts. Well, the hygienist is going to spend some time with the patient. So if they could be gathering some of the facts and asking the patient these questions, how soon do you want to have this done? That's one of the things to determine. Is insurance, how big of a part of your decision is the insurance coverage? Might as well bring that up and get it covered in the beginning. Because I think that's fair to both the patient and the doctor to know what are our limits? How much can we do? How much is the patient going to allow us to do? All right, so why do we do exams? That's part of it. But the other part is that we're looking for problems the patient may not be aware of. And those usually are seen because of what I referred to earlier as the signs, but they also may be on radiographs. And what's a radiograph? Well, a radiograph is an image that we used to call them x-rays. But now it's on a computer screen. And there's a thing that we do to help us get that image onto the computer. Well, that's part of our information gathering process. Now, there are patients that don't want x-rays. They've read someplace this, or this. And for that reason, they don't want x-rays. Well, if you're a patient and you're listening to this, then what you're doing is you're denying us a way to gather all the information. And doctors tell that to the patient. I understand that you may not want radiographs. If that's the case, you're kind of tying my hands because I don't have all the information. There are other things I can use to help come to a conclusion, but the radiographs are often a big part of that. Now, and there is a radiograph that I think it's common, it's commonly used, and it's a very good tool as far as being an aid in viewing the patient's whole face. This part of, not the top of the head, it's usually not below here, but it's called a Panorex. It goes all the way, you'll see it. I mean, the doctor will show it to you if you ask, and that's a screening tool. It gives a lot of information, and there's a lot of information that can be found on that. And okay, so I'll give you an illustration. A patient came in one day, we did an exam, and I said to them that you've got an infection here. It showed up on the Panorex. If we had not done that Panorex, I wouldn't have been able to see this. I said, you've got an infection over here. And I said, from the size of it and the appearance of it, that's been there for some time. And the patient relayed to me that the doctor had, for, I think it was 7 years, the patient off and on had been taking antibiotics because their doctor, their physician, knew they had an infection, but they couldn't find where it was. Well, it turned out, and right now I don't remember what's in the right or left, but it was right down here on the corner of the jaw. It was an infection. Put them on an antibiotic, did the treatment that we needed to take care of that, and within 6 months they were off. They were off the antibiotics. Their doctor knew, and then their physician found out what that was, and so they were off the antibiotics. And that's the kind of thing, and there's much more. I mean, there are many other sinus issues. Things with cysts, teeth that are missing, that we can tell parents about that before the patient finds out that they don't have it because a tooth hasn't erupted. And it's just a lot, and those images help us a lot in terms of being able to present the facts. All right, so I've talked about the exam from the doctor's point of view, from the hygienist's input, and from the patient's point of view. And what I would say to you is that when we talk about doing the exams, remember I said that the most commonly used term now is an evaluation, because we may do an evaluation that's really problem focused, and then that leads to an evaluation that may be a periodontal evaluation, which then leads to an evaluation which is a comprehensive evaluation. And so all of those things work together. And it's my goal that from presenting this to you and giving to you the analogy of a detective gathering the information, he's gathering all the facts together, and then the doctor, he or she, and then the doctor puts this all together, reports it to the patient, and then comes up with a treatment plan. A treatment plan means this is how we're going to fix that. And the patient then has input on the treatment plan also. And if we give to you a treatment plan that seems too complicated or seems confusing, then ask the questions. Because the whole purpose of what we're doing is to be able to answer your questions, interpret what you're telling us and asking us, so that we can come up with a treatment plan, either to help you get through a situation or help you avoid situations that we see coming in the future. And my purpose in this is to be of assistance to doctors, to the hygienist, and to the patient. And as I said, if there are other questions that you have, and I'm available, you can ask me, or you can ask the doctor or the hygienist. And I thank you for watching this, and I thank you for the time you've given us. Thanks.